What's up, Dr. Doug, man? It's good to have you on the podcast, brother.
Larry, it's nice to be here.
Yeah, man. It's good to have you. So, hey, before we get started here, I'd love to just start with your journey actually into the medical field.
Yeah. Well, into the medical field or in the medical field? I don't want to go too long here.
Yeah, it's true. I would say, how about in the medical field?
Yeah. Yeah. My background's a little funny. It's a good story for another day. In the medical field, so I started as an orthopedic surgeon. I went to medical school through the DO route. So if your listeners aren't familiar with that, that's a doctor of osteopathy, legally the same as an MD, just different philosophy, different training. But ended up in a traditional medical practice as an orthopedic surgeon after finishing up training. My subspecialty was in foot and ankle. And so I did general work, I did trauma work, I operated on a lot of feet. And what was interesting about that is that it led me down this path of understanding how significant the diseases are that impact feet in particular, like diabetes, but also other diseases that are impacting us in the space of aging, how important nutrition is, how important all of the things that we don't really talk about as doctors are. And that really pushed me out of orthopedics after about 7 years into pursuing some additional training so I can do what I do now.
So with feet and all that, so you and I was in medical device sales for 18 years, and mostly spine, and in the thoracic region is where I stayed. That's where a lot of
Mm.
my devices were used. But the last job that I had, where I was there for 5 years, we had a debridement device. And so we did a lot of diabetic foot ulcers that were just absolutely just heinous. And but yeah, it's overall health that I think a lot of people don't even really think impacts just not only, cardiovascular or something like diabetes, but all these limbs, the things that actually happen like on just these areas that we don't even think about. Like when you think about diabetes, you think of blood sugar. You don't think of like, oh my gosh, I could lose my foot, if I don't take care of myself.
Yeah,
But
exactly.
I'm curious, what was your motivation from going from orthopedics into what you're doing now?
Yeah, so a lot of it had to do with where I felt like I was serving my best mission, and this sort of kind of was a multiple year process to figure this out. But I was never really happy practicing orthopedics. I think that my intent and my purpose behind getting there was very much driven by the wrong desires and goals. I was very goal oriented. I loved the thought of being in the operating room, and there's a lot of ego that goes along with that. But when I got there, I did like operating. In fact, I loved operating. I loved being in the OR and what we can do with the cool instrumentation that people like yourself would sell. Um, and that was a lot of fun, but I was just not fulfilled internally. I would go home and not be happy to be home with my family because I wasn't happy at work. And then as we started having kids, I realized like, man, being kind of a crummy father because just something is missing. And so that really led me to go down this pathway of figuring out like, what is my mission? And you and I've talked about that quite a bit in the past. And it's really important, or at least it was for me, to be able to figure out that I can do something that I wake up and I want to do. I wake up and I do, and then I'm excited to tell my kids about it, my wife about. And that's what I do now, which is to help people to really find the best version of themselves physically so that they can really show up for themselves and for their family. And that I find so fulfilling. Um, Sitting in the traditional medical model, I liked the competitive nature of it. Again, I liked operating, but I was hollow because I wasn't really serving a mission.
That makes total sense because I think a lot of people really look at a position like that and they're like, oh my gosh, like you have truly made it, right? But I agree with you. I remember when I was in pharmaceutical sales and the big dream was to go into medical device sales because it was glamorous. You got to be in the
Yeah.
OR. And what I think a lot of people don't really realize about the OR is that while it's a cool place, it can feel, depending on what it is that you want to do with your life, right? If you want to be in the OR and that is your life's purpose, right? It's fantastic.
Yeah.
But I think for yourself, and I found myself in that position too, where I was standing, 2, 3, 4, 5, 6 hours in the OR in cases, and there's no windows. You kind of feel like you're completely like in a bit of a prison in a way. You can't touch anything, right? You got to wear all these different things. You got to wear something on your head. You got to wear something over your face. You got to stand a certain amount of feet from the sterile field and all these different things. And
Yeah.
and it wasn't as glamorous is what I think people really see. Was there actually a moment for you where, because I remember mine, I think a lot of people who make career changes, they're just like, well, not necessarily career changes, but just a different direction, where they remember like a very distinct moment where they're like, you know what, just done here. Just not doing this anymore. Was there a moment
Yeah.
like that for you, or was it something that happened slowly
No,
over time?
there was totally a switch that flipped for me. And this was after, so I started practice in Durango, Colorado, and loved living there and had really the dream, right? Like, as you said, on paper, I mean, I finished my fellowship at Stanford, private practice in Durango, Colorado. Like, that is the dream for the orthopedic surgeon. It's like the cream of the cream of the crop. And then I already mentioned I was unhappy. So we left Durango and pursued actually my wife's business, developing that around Asheville, North Carolina, where we are now. And I joined another private group to call it a really busy, high level trauma center. And so we were, dealing with some kind of really bad injuries, sick people. And that's some of the challenge that comes along with the space. And that's okay. But one of the cases that, or really the case that did it for me was, this was a call case. And these are always the cases that I'm sure you probably had to go to them too, right? It's the middle of the night. We try not to do them, but sometimes you have to. And this was ironically another diabetic patient. This is a guy I got to know pretty well, but at the time I didn't know him at all. And they called me because he had a wound on his foot and it was infected, and he was septic, which means he has bacteria in his bloodstream and his blood pressure is going crazy, and he's like ready to die. So the solution for that is put him on antibiotics and then take him urgently to the operating room and do an amputation, right? So I'm in there. We're getting ready to do this amputation, which is not a fun procedure in general. And this guy is big. He's 400 plus pounds. And if I know you've done cases in the middle of the night, but when you do cases in the middle of the night, there is a skeleton crew, usually of not people that are local, right? These are the people that they brought in from other areas to take call. So they don't know what they're doing. They don't know where anything is. It's not a good time to do surgery. And so we're positioning this 400-pound patient on a very small operating table in the middle of the night with a skeleton crew. And I'm sort of up to my shoulders and elbows in this guy's thigh, trying to get him on the table. And it just like dawned on me at this point where like I felt like my physical health was in jeopardy, that this is stupid, and that this guy has diabetes and he has obesity, and these are things that with the knowledge that I have, I can totally fix this before it gets to this point. And it just dawned on me that night where like I'm just chasing my tail and I'm chasing my patients' tails, because we're missing the boat early on. People are getting terrible advice. I want to speak the truth that I know because I've seen it in my own practice and my wife's practice. I know we can help people that are suffering from this problem in a totally different way and prevent them from getting to the point where I was that night.
Oh my gosh. I'm like just vividly with you there,
Mhm.
where you're just having this realization of like, if I could have probably have gotten in front of this guy maybe a handful of years ago, he probably wouldn't be on this OR table right now.
Yeah, totally. And
Yeah.
this guy, so I got to know him pretty well. So he was a really nice guy. And this is a funny thing. And if there are any doctors listening and you haven't learned the fact that diabetes is reversible yet, listen up. So this guy was not only a super nice guy, he was young. I think he was early 30s. And he was young. He did not have a genetic condition. So this was true, like adult onset early diabetes that was really poorly controlled. And I thought in training that when you see a patient like this, that they're just not following our advice, right? Like this is the
Right.
doctor, like ego. If you would just do what I say, you'll get better. But the truth is, this guy was following that advice. He was eating, the right ADA diet, and he was taking his drugs right on point. He was taking the insulin. He was doing all the things, and he was progressively getting worse. And what most people don't know is that when you follow that pathway, you will get worse. If you want to put diabetes in remission and reverse it, you have to think outside the box. And this is where I sort of, again, that switch was like, oh, if I could just start teaching people how to think outside the box,
Yeah.
create a platform for them where we could educate people that, hey, you don't have to suffer from diabetes like this. You don't have to, I do a lot of like bone health work, right? You don't have to just expect that you're going to lose bone and have a hip fracture and die within 6 months. Like there is another way, but you're not going to get it from your doctor in the traditional medical system.
Really fascinating. And especially now because there's so much information out there. Like all you have to do is literally open up your phone,
Mhm.
Google, social media. There's a plethora, there's a buffet of information out there. However, I would love for you to just kind of give us some grassroots because, I actually got my degree in sports medicine with a minor in nutrition. So like,
Hmm.
even though I was in medical device and all that, I've always had this passion for being very, very proactive with our health, basically wellness, not crisis care, but wellness.
Right.
But the story that I'm telling myself, because you go out there and you do some research, that society right now has never been more obese than we are
Right.
right now.
Right.
There's never been more obese, uh, just induced disease now.
Right.
And and people are, I think, to be quite honest, a lot of people are confused of what to do and how to do it. But, what do you think has been some of the biggest culprits of just our degeneration of wellness and health over the years?
Yeah, it's a really interesting topic, and I try not to be biased all the time. I mean, we're all biased just by the nature of being human. I try to be open minded. I live in my own ecosphere because that's what social media does for all of us, right? I'm only exposed to the things that I like. Um, but I do try to look outside of that, and I'm around people. And you actually introduced me to someone recently, who has a very different perspective on nutrition. And it was interesting getting to talk to this person, their perspectives, and they're obviously like a very healthy person, and or at least they are right now. And so it just got me thinking recently, like, man, it is so important to have an open mind about these things and stay out of, like, I would call it like the diet wars. Like, is keto better? Is vegan better? Is carnivore better? And I feel like really we're missing the point. Like, you can actually be healthy and eat any of those diets. Maybe it's just another topic. But to answer your question of what got us here, I think it was not the extreme diets. I think, in fact, the extreme diets are probably making it worse. I think it was, if you start going back, like 100 years, what did we eat in 1900 or 1920? Right. If you look at what the food supply was for most people in the 1900s and 1920, it was very simple, right? It was meat from a local farmer. It was likely dairy if you lived, again, close to a farm. It was locally raised and, small and organic by definition, vegetables and fruit, and only fruit in season because they couldn't transport it very far. Right. It was a very, very simple diet, and, a little bit of grains here and there, but different grains than we have now. So fast forward 100 years, and what you've seen is a little bit by need, because of population growth and urbanization. But by need, we've had to make foods that are calorie dense and nutrient poor. And that was by design. And some people will say, oh, there's this, malicious, intent behind creating highly processed food. And maybe that's true, but actually, originally, I think it was so we could transport food into cities. So we could transport food away from farms and away from the shoreline. And so you had to make these foods that were processed because they had to survive the transport. And then they needed more calories when starvation was a thing. And if you go back to, like, think of this time era, right? Like early 1900s, you had World War I and World War II. Like, there was a food shortage, right? Like, rationing was a real thing. So a calorie dense, nutrient poor food at that point in time was not a terrible idea, but it is a terrible idea now. So then what's happened is now we have an abundance of food. We have, food for, except for people that have food problems, but for those of us that have access to food and the means to buy them, we have more food than most of us could ever eat. In fact, we have more food than we could ever feed most of the population of the world. In fact, we could probably double the population of the world with the amount of food that we have, because so much of it's thrown away. But the challenge is it's nutrient depleted and calorie dense. So people are getting fat, and you could argue all the, the different macros, and it's the carbs, or it's the extra fat, or it's the saturated fat. The big picture is it's nutrient poor, calorie dense food. And it's easy to get away from that. And you can do that through eating a mostly plant diet, through a mostly carnivore diet, through a keto diet. There are a lot of ways out of that thing, but you got to get out of it one way or the other.
So it's really choosing how the food is grown or raised properly. Is that correct?
Well, to some extent, but there's a lot of knowledge that has to go into this. And this is where working with somebody who understands agriculture, and animal husbandry is really important, because now, again, 120 years ago, the wheat that was grown in this country is not the wheat that we have now. The corn is not the same corn. Even if you're buying organic corn, it's a totally different grain than it was 120 years ago. It's a different grain than there is in Europe. And that's why people that can't eat bread in the US, or they'll have really bad stomach issues, can go to Italy and eat bread and be fine. There's different wheat, there's different grain. And so yes, the answer is yes, you can identify the foods that are going to be better for you with some simple decisions. But it takes some education.
Interesting. Yeah. I mean, I guess it's just because the society as a whole, we want something that can be on our shelves for a long period of time.
Absolutely.
Right. We want, like you said, things that transport. And it's really interesting too. If you look at, like, I'm one of those really nosy people that when someone's ahead of me or behind me in the supermarket, I'm always like checking out what they buy,
Totally.
And I was just at the grocery store this past weekend, and I was looking at the lady behind me with these two little kids. And dude, just about 90% of her groceries were either in a box
Yep.
or some sort of package. Right.
Absolutely.
There was some fresh fruit. There was some vegetables, but everything else was like boxed donuts, Lucky Charms, bagels, and cream cheese and all this other stuff, regular run of the mill milk, that kind of thing. And like,
Right.
definitely conventional meats. There wasn't there wasn't the choosing of the organic meats or the grass fed meats or anything like that. So you're sitting there and you just kind of like take in consideration. You're like, wow, that's an arsenal of stuff going on there that,
Right.
that basically our kids are. The other thing too is I look at my kids' lunch menus at school
Mm-hmm.
and I'm like, why are we feeding kids French toast sticks and syrup in the middle of the day? No fruits and vegetables. That's your
Yeah.
lunch. You have a
Great
choice of
question.
either regular milk or chocolate milk or some sort of sugar filled
Oh,
laced
and
drink.
it's not regular milk, it's skim milk.
Oh,
Just
it
for the
is.
yeah.
Yeah. So just things like
Because
that I'm
dietary
like,
fat's bad. Yeah.
yeah. Cause just things like that I see, I'm just like, and one day it's grilled cheese, one day it's a hot dog, one day it's a hamburger, but it's like the same, prisoner food that's kind of like in rotation, it seems
Yeah.
like. Yeah.
Yeah. That's why we pack our kids lunch, and they
What
don't
do you,
always eat
yeah, what do you pack them? Let me ask, how old are your kids
it.
and what do you pack in their lunch?
Yeah. So I have an 11-year-old, an almost 10-year-old, and a 4.5-year-old. And so yeah, this is always a fun conversation. So our kids are pretty well developed socially, despite the fact that my wife is a PhD nutritionist and I'm a physician in this health optimization space. So our poor kids, they hear this stuff all day long. But we don't. I restrict my diet quite a bit. I don't restrict their diet quite as much. So, for example, my oldest, who he has issues with gluten, so we're mostly a gluten-free household. But he likes to eat some kind of a protein source. So he knows he needs something, and it could be like a leftover steak, chopped up. It could be, hot dog is okay, depending on where it comes from, although it's mostly a fat source, not so much a protein source. Um, he'll occasionally do a sandwich on gluten-free bread, but he doesn't usually. So it's usually some kind of protein. And then there will be a fruit in there to some extent. And then he does have some kind of like a packaged thing. It could be like an organic corn cheese puff or a kind bar or something like that, which I don't love, but I want the kid to develop in a relatively normal way.
Yeah,
He's at
yeah.
a
No, I totally
disadvantage.
get that.
And his siblings are otherwise similar. And that's kind of how we eat all of our meals. It's protein forward, preferably from animal sources, and the kids don't need nearly as much as we do, but they still need to get that minimum amount in. So between 10 and 20 grams of protein per meal for the kids, and for us it's 30 or more. And then you can kind of backfill it with whatever you want. But as long as you get that first part in, then I'm pretty relaxed on what the rest of it's going to be.
That's really cool. I like how, you guys are protein first, and but it's not anything to the extreme either. They can still, be, I hate to even use the term eat normal because like that's, it's kind of, but from a society standpoint, they're
It
not,
is.
yeah, they're
Well, and
not good.
I mean, honestly, I'll say that they still they still stick out quite a bit because they're not going to eat, if it's garbage pizza, like they get these free, like, I'm not going to call out any pizza brand names, but like a well-known brand name of pizza, which is just garbage wheat with a little bit of sauce and not a lot of cheese, right? Like this is a pile of garbage grain, and they know that, and they won't eat it because they know when they do, they feel terrible.
Yeah.
Same thing with like all the sugar, food coloring, high stuff. Like they'll look at it and they'll be like, you know what? No thanks. And it's amazing to have watched them get to this point because they are so selective now because they know how to listen to the feedback that their body gets. My oldest, especially because he's gluten sensitive, sometimes he'll eat off plan and he knows it. And he'll be like, Dad, yeah, I mean, the last couple of days I've had this or that, and my stomach like doesn't feel good. I'm like, sorry, buddy.
Yeah.
It's okay. And I hate it too, because he'll be at like this birthday party and everybody's having cake and he's just like, oh. I'm like, dude, just have a piece of cake, but like a little one.
Yeah. Yeah. I think you do get up to that point though. My oldest is now like that. You actually met Ethan at the
Mhm.
at the summit that you were at, and he just started wrestling season today as we're actually recording here at the beginning of November. And we were talking last night. He's like, Dad, he's like, I really want your help to help me keep me accountable. I was like, keep you accountable for what? He's like, I just want to, I want to eat cleaner than what I am now. And I was like, yeah, I can definitely help you with that. And I said, Ethan, I was like, we've been down this road before. Like he's gone through bouts like where he eats like really, really clean, especially like during his wrestling season and stuff like that. And I said, some of the best reminders that we have, the best way to actually keep us accountable is that when you're eating healthy is to go out and eat something terrible
Mhm.
and take really good note to how you feel. It's like I joke around all the time with my kids because they'll want to go to McDonald's and they'll be like, Dad, are you getting anything? I'm like, are you kidding me? Like, dude, I haven't eaten McDonald's in 25 years. Like me and my son actually last year had a bet for No Shave November that if I shaved my face or cut my hair in from November to the end of the year, that I would eat whatever McDonald's he put in front of me. And I won that bet.
Oh,
I was like, if that's the
not a
bet, I'm
chance.
not losing this bet. I'm sorry. It's not going to happen. Like that's a motivator for me to not do that.
Yeah.
But some of the ways like, you mentioned it with your son that like, well, if I eat this cake, like might taste good, but it's going to make me feel terrible. And I think sometimes the best way to keep us accountable is like, hey, incorporate something every now and again that you don't necessarily doesn't agree with you. So you can be reminded of why
Yeah.
it doesn't agree with you.
Right. Yeah,
Yeah.
it is. It's so when you live a quote unquote restrictive lifestyle, you do sometimes feel left out and you get into this like victim mentality of like, oh, like I can't have this or I can't have that. And I live what some people would consider very restrictive. Like I eat very specific foods. And one of my weaknesses is like protein bars. Like because they're packaged and they're convenient and I can throw them in my bag and whatever, they taste good and they're chocolate and it's like the only sweet thing in my life. But for me, like just yesterday, I didn't have any food. I didn't go to the grocery store. I was like, all right, whatever, I'm just gonna eat this protein bar. And man, what did I feel? I felt hungry after I was done, not full, even though it had whatever. I ate like probably 500 calories worth of protein bar. And so I was hungry. It was very sweet, and that just triggered me to want more sweet. And then it had sucralose in it, which makes me really gassy. And so, like, for the rest of the day, I'm like, well, this is my reminder of like why I don't eat protein bars, and they're just like, I like to go back to the idea of like the ancestral diet, which is if it didn't exist before 1900, we shouldn't be eating it. And then when you do that, like it cuts out
A
like
lot.
90% of that lady's grocery cart, right? Like it's
Yep.
gone, right? You're left with the meat, the crap dairy that she had, and the little bit of fruit that she had. But if you make that your whole diet, then there's a lot of room for, conversations around, macros and how much this, how much that, like a lot of that goes away. You don't have to be that picky because you just don't have that many choices.
So true, man. It's so true. I want to switch gears here for a minute because one of the things that I know we're going to talk about today is the importance of taking care of ourselves. And
Mhm.
you're speaking to an audience, and quite frankly, you help men on the daily, and so do I. Is that's one of the hardest things for us to do, even when it comes to eating something that is healthier, right? Because usually eating something healthier, quite frankly, on a price tag perspective, it's going to cost you more.
Yeah.
So part of our self-care, like, so for instance, like the foods that I eat, I always want to make sure I am eating high octane foods. Like my kids are always like giving me crap because they're like, you eat so many vegetables. Because I do. I eat a lot of vegetables, a lot of greens, a lot of microgreens, a lot of, broccoli sprouts. I like a lot of colors in my meals when it comes to my vegetables and that kind of thing. My kids are like, you eat so many vegetables. I was like, I do. I was like, because I feel terrible if I'm eating other things. Like last night, my 15-year-old son made dinner and he made shrimp Alfredo. And it's probably been 15, 20 years since I've had a white pasta for dinner. But I wasn't going to be, I mean, this kid slaved over this meal and he actually had to make it for culinary classes homework. And I got to tell you, man, he did a bang up job. It was delicious, but I'm not going to be like, no, I'm not going to eat that.
Right.
But I'm going to be like, I'm going to eat that. He made it, and he's so proud of it. But I had to pay the price of like, cause my body just doesn't do well with gluten. Right. But the foods that I eat, they're just by what they are, they're more expensive. And it goes back to like self-care. It's like, yeah, I could probably go to McDonald's and get a Big Mac for $1. The meal that I'm eating is probably going to be $6 to $7 minimum,
Right.
or maximum 10 if I'm making it at home, but it's more expensive. But I'm okay with that because I know that it gives me less brain fog. Physically, I feel better. If I feel better physically, mentally, emotionally, I'm going to feel better. If all those levers are pulled, I'm actually going to show up better for them as a dad. But it took me a while to get there. But I'm sure you deal with the same stuff with your clients.
Totally. Yeah, I see, money is such an interesting driver. Because it can really it persuades so many decisions throughout the day. And so one of the things, actually, I'll steal this from my wife. She uses this analogy, which is imagine, if you were told that you can have a free car, like when you're 16, you're like, hey, guess what? You get a free car. Awesome. And it could be any car you want. Totally awesome. Right. But here's the catch. It is the only car you're going to have for the rest of your life. And you're going to live for a long time. Oh my gosh. How good a care would you take of that car?
Yeah,
I mean,
probably
that car
impeccable.
it would be washed. It would be clean. If it needed like premium fuel, man, that thing would have ultra premium fuel, like whatever the highest amount of octane I can get in there. I don't care how much it costs. Right. And that's the point, is like,
Wow.
we look at our bodies. This is the one vehicle you get, as far as we know, for the rest of your life. And yet I see people just like you, and I look in their grocery cart, and I try not to judge, but I look in their grocery cart and I'm like you intentionally chose to get this meat instead of this meat. You intentionally chose to get this dairy instead of this dairy, right? You made all of these choices at the grocery store to save money. And I totally get that. And not everybody has the resources to buy whatever they want. Totally understand that too. But even on a really tight budget, you can still make better choices, because this nutrient poor, calorie dense food might be cheaper, but it doesn't have any nutrients.
Right.
Right. So you end up needing more to get the nutrients. You're craving food all the time for a lot of reasons, but a lot of times because you don't have the nutrients, you end up having to eat more of it. And then you also suffer from an obesity perspective, right? Because now you're consuming 4,000 calories to get the same nutrients that you could get in 1,500 calories of a nutrient dense diet. And so understanding that this is the one body we have, for me, like we budget and we do all that stuff. Like, I don't ever want to talk about the food budget. All right. Like, I know that if I am working the way that I work and I run the business the way that I need to run my business, I can buy whatever food I want. That is one line item that I'm not going to compromise on. Now, I might not take the same vacation list this year as I did last year, right? Like, those are areas where I'm willing to compromise, but food, not one of them.
And why do you think most people do compromise on food? Do you think that we just make simple financial decisions on food, or what do you think it is?
It's expensive.
It is
Right?
expensive.
And it's in your face, and this is like, it's not like, I mean, if grocery stores, maybe I bet this is probably coming, so I shouldn't even say this, but like, get on the subscription model for food, right? Like, let's get on the subscription model for your Cheerios and your oatmeal, and it's going to show up at your house and you're not going to think about it. Like, that's how you stop thinking about the cost of food, just like we stop thinking about our Netflix subscription. But when you have to go to the store and buy it, and you're spending the money and you're looking at your budget and you're like, oh, I want to do this thing this weekend and it costs this much, and wow, like, this is, I mean, when I go shopping for, like, if I'm going for a week for our family, and I'm going to like to Whole Foods because we go other places too. But I mean, I could spend $700-800, right? Like that's a lot of money. And so it's just in your face, and it's an easy place where you could say, well, hey, I could cut back here, 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 and I can knock that down. But you're doing it at a significant cost. I see the same thing in sleep. This is another area where like, you're like, well, it's the same thing, right? Like I could sleep for 5 hours and I'm going to feel just as good as if I sleep for 8 hours. And you're like, maybe, probably not. And you don't understand the consequences because they're not acute. Like you don't feel them right away.
Mm-hmm.
You know, you're going to feel the consequences of a bad diet down the road. You're going to feel the consequences of poor sleep, maybe the next day. But if you do that consistently, you're going to feel it down the road. So I think we're not good as humans as understanding long-term consequence so much as short-term consequence, right? Like none of us put our hand on the stove when it's hot. We know what that's going to feel like. But
Right.
making poor decisions around food is a long-term consequence that we're not good at processing or at least putting action to.
That makes a lot of sense. Cause I mean, the consequences they're not immediate. Like you said, they're felt over time. You know, since you brought up sleep, I do want to briefly talk about that before we start talking about the roles of testosterone. There's some peptides in here that I have questions about, even our sexual health and that kind of thing. But you know, you look on social media and everybody's like, sleep 4 hours, grind for 20, you know, and
Right.
like that's the message out there: sleep
Right.
less, or you'll sleep all you need when you're dead. And, you know, many people are like yourself, you know, who are experts are just like, that's actually the one gift you can give yourself
Mm-hmm.
is the quality sleep. But what does high quality sleep, number one, look like? How much sleep do you recommend that
Yeah.
a human being needs to be optimal, and
Yeah.
why?
Great question. And this is probably the number one thing we see with people coming in. So when we bring people into the practice, we have them sit down with one of our coaches or dietitians, and they kind of run through this like long lifestyle questionnaire. And for the most part, we work with really high functioning people, entrepreneurs, physicians, you know, people that are like really want to perform better. That's why they're working with us. And consistently, unless they've kind of been in the space for a while, and then it's kind of like one end of the extreme. Either they are ultra protective of their sleep, or they have terrible sleep. There's really not a lot of
No
people in
middle
between.
ground.
No. And the people that are ultra protective have it just dialed in, and there is nothing that will keep them from getting their sleep. And that's awesome. And they, you know, they're doing great. So we're working on other stuff. But most people, when they come in, they have sacrificed sleep for something. And it is, you know, because you know, it's the time I can spend with my wife. It's because I love watching TV. It's because I have to get that, you know, extra 30 minutes of email. We all know the list of things that can keep us from sleeping, and it is long, right? And like I said earlier, we don't know the value of sleep. Like you don't understand, like, why do we sleep? It's such a crazy thing out of the gate. Like what even happens during sleep? Why would we spend a third of our life sleeping? It's insane. And yet it has been preserved for millions of years in basically every species on the planet. So like it's a thing, whether we understand it or not, it's been preserved. We should probably respect it. And so what I tell people is, all right, let's just figure out, you know, how much sleep you need. And most people say, oh, I need 5 or 6 hours. Because again, we work with that group. And I'll say, okay, cool. Well, if we look at the data on short sleep starts at 7 hours. And what I mean by short sleep is in studies, they'll talk about getting adequate versus not enough sleep, and they call that short sleep. So if you're short sleeping, it's by definition less than 7 hours. And that's of actual sleep. That's not sleep time. So to get 7 hours of sleep, you actually need to be in bed on average about 8 hours, assuming you're getting pretty good quality sleep. Now, most people are not in bed for 8 hours, right? So already out of the gate, like we're not off to a good start. Most people are in bed for 6 to 7 hours, which means they're getting 5 to 6 hours of sleep, and that is woefully inadequate. There are some genetic variances which will say, "Hey, I'm a short sleep person," but that shortens the window by 30 minutes, not by 3 hours. So can you get by? Of course you can. But what I see is that people have been doing that for years. They come in, they have extreme adrenal fatigue. They don't make cortisol anymore. They're relying heavily on stimulants. And they're kind of running to the end of their rope. That's also why they're here. They're like, I can't keep up anymore. Like my physicians, I've got several surgeons because of my background, and they're like, I can't get through my OR day. Like I'm having to lean on my fellows to finish cases because I'm exhausted. And that's adrenal fatigue, right? Like they're just done. They need to pull back, sleep more, recover. Don't need to quit their job. They just need to like get their body back. And getting optimal sleep is the number one thing you can do to help do that. So what I tell people is you need at minimum an 8-hour window with a goal of getting 7 hours of sleep. You should probably track. Sadly, I don't have mine on right now, but it's right here. My Aura Ring,
The
right?
Aura
It's
Ring,
a
yeah.
couple of different ways to do it. I've got an Aura Ring. Whoop is another good tool that I like to use. But use something, and something that's relatively accurate. And then you can just track over time. And so for me, I know that if my sleep time dips under 7 hours, I start to kind of slide. Right, like I start to have cravings. I'm just not quite as on. I just don't feel as good. I'm not performing as well. Like it all starts to slide, and it's like on the nose. I mean, if I get to like 658 average for the course of a week or two, like I don't feel good. If I push it back to like 705, I feel fine. But for me, that's 8 hours in bed. And so then you get into the entrepreneurial guys who are like, get up at 4. I'm like, that's fine, man. Get up at 4. Because honestly, working from 4 to 8:30, when I do get up at 4, if I have a sick kid or whatever, like it is, I understand. I get it. Like working from 4 to 8 is a fantastic work window. It just means you need to go to bed at 7. Right. And you never
Right.
hear the other side of that equation, which is when do they go to bed? And a lot of these guys do go to bed early. I think the challenge is when you get people that get into these ecospheres and they're like, get up at 4, but they don't fix the other side of the equation. They're watching Netflix with their spouse until 11, and then they get up at 4, and they do that for a couple of weeks, and then they feel absolutely terrible, right? And then they're like, I failed, I can't do it, I must not be as cool as these other guys, I must not be able to be successful, right? And it's just like that downward spiral of failure, but they didn't set themselves up for success.
It's interesting. I used to be a part of the 4 a.m. club for years. And this was going back several years now. It's probably about 2018 to 2021. I was doing that. And the interesting thing is I would get up at 4:05 every single morning. I'd be in the gym by 4:30 to meet my accountability partner, and we'd work out, and I'd work out until 6:30. And I could not get the scale or my body fat to budge, no matter what I was doing. Like, no matter what I was doing, I was like, this is crazy. I'm like killing myself. And the one thing that changed the most, and number one, my son and I did a bodybuilding show in 2022, and we started training together. But all I did was, I switched up my diet quite a bit. But the biggest thing that I did differently was I stopped waking up at 4 a.m. because we didn't train together until he got off school at 2:30. So like we'd be in the gym by 3. So I was able to actually sleep until about 6, and I go to bed at like 10. And I could not believe the difference in how I felt, how I performed, my workouts, and then, body fat just started to completely just slide away. And but the biggest thing I would actually take a lot of pride and be like, oh, look at that, 5 hours of sleep, still going, right? And the average of my sleep, if I looked at my Fitbit, because at the time I was tracking all my sleep with my Fitbit, I was averaging 5.5 to 6.5 hours of sleep a night for years.
Yep.
And body fat.
It's really common. I did that when I was in practice. I mean, that was me. That was me. We would stay up and hang out until 10:30, 11 o'clock, and I was getting up early to get into the hospital and around. Same thing for me recently. I was kind of plateaued on my body comp goals, and I had a photo shoot coming up, and I was like, well, if I'm gonna look the part, like I need to really look the part. And so for the first time, I was like, okay, what's the one thing I can do? Because I eat pretty darn well, I work out hard, and actually what I did is I worked out less and I slept more. And same thing, right? Just started losing body fat.
Crazy.
And I think that we do tend to overdrive, those of us that are high achieving, goal oriented people are like, I want to go as hard as I can. But a lot of times it's too hard. It's too much.
Yeah, too much. I want to talk about peptides a little bit. These are, I don't know how long they've been out. They're newer to me as far as like my knowledge of them and what they do. But I know that these are big in your space, but I think there's probably quite a bit of confusion out there of what exactly a peptide is and what they do. So can you briefly share what they are, what they do, and just some common ones that you use and why?
Yeah. So Gosh, I was introduced to peptides when I started making this shift out of orthopedics. So I did an additional fellowship with this group called A4M, which is the American Academy of Anti-Aging Medicine. They're big into peptides, and I think they actually either founded or joined or whatever this thing called the International Peptide Society. So it is they are doing their best to educate and to bring together peptide providers, and even did a certification in peptides. So I've talked a lot about peptides, and for people that don't know what these things are, peptides are simply short amino acid chains, so kind of like shortish proteins that are made by compounding pharmacies, typically by prescription, but they live in the space between drugs and supplements. So this is a challenging space because the FDA regulates drugs and drug companies make drugs, and they do really good research, arguably, on drugs. Whereas supplements, it's the wild, wild west, right? Like it could be anything. You don't know what's in the capsule, and you have to trust a company, and who knows what the thing is. Whereas peptides are a very specific thing. They are made under tight regulations. However, the FDA does not control those regulations, and therefore the FDA hates them. And I say that openly. Recently, they came out with a position statement against peptides that is sort of like leaning into this, like pushing pharmacies against compounding the peptides, not because they're not safe. I think it's just because they don't have control, and they want to have control. It's a governing agency. That's what they do. But they are still available. Some pharmacies have stopped making them because of pressure from the FDA, but they are still available, and they are very impactful when they're used in the right way.
And what are some of the most common peptides that you see in your practice, and why would you choose those peptides
Yeah.
for certain patients?
Yeah. So it's funny when I ask people, hey, have you ever heard about peptides? They're like, oh yeah, I'm on peptides. I'm like, oh, cool. Which ones? And they'll say, I take collagen. Oh, right. That is a peptide. And so let me just describe over-the-counter versus prescription real quick, and then I'll tell you about the ones I like. So there are like collagen peptides is a thing. There are other skincare peptides that are out there, copper peptides, et cetera. Because the definition, again, is just a short chain of amino acids. So you can make peptides, and they could be supplements. And there are actually some peptides now and some supplements that are pretty cool. But the powerful ones are still going to need to be prescribed. And so these are the ones that we prescribe and that we recommend to our patients as part of a comprehensive plan. And for us, since most of our patients are looking to perform better, generally they're going to be going through some phase of building muscle and putting on a little bit of bulk, and then we cut them back. Not like necessarily as extreme as a bodybuilder, but I think everybody should have a little feast and famine in their life. So then we can design the peptides to help go along with that. So one of the most, I would say by far the most popular class of peptides, both in our practice and elsewhere, are the IGF-1 category peptides, also known as growth hormone secretagogues. And so IGF-1, if you're not familiar with that, stands for insulin-like growth factor. And this is really interesting biomarker that we get in our lab set. But there's a lot of debate around this biomarker because it lives in the longevity space. And so you can read some books, like if you listen to like Mark Hyman and Dan Buettner, who wrote the Blue Zones, and the people that are very plant-based leaning, they will say you want to drive IGF-1 down if you want to live forever. This is like David Sinclair, same thing, right? Like drive IGF-1 down. The animal studies show that you can extend your lifespan by 30-40%. And that's true if you're a mouse. The problem with that is that if you look at mice that have low IGF-1 for the course of their life, they have no muscle mass. They're tiny. And yes, they live longer, but they're in a very controlled environment. And so for us as humans in a relatively uncontrolled environment, we need to be able to compensate for stepping off of curves, and we need to maintain our muscle mass as our primary organ of longevity. And you cannot maintain muscle mass with low IGF-1. So I really disagree with this whole longevity push for low IGF-1, because if we do that, we will see really skinny people that might live long enough to have a hip fracture. And that's probably the outcome that's going to happen. And so for me, I say, well, look, IGF-1 isn't the evil that we think it is. IGF-1 needs to go up in order to build muscle. And if you look at things that we know are going to be helpful in that category, like eating a protein-rich meal will drive up IGF-1. The people that are advocates for eating a plant-based diet will say, well, that's why you shouldn't eat a plant-based or shouldn't eat an animal-based meal. But the same thing's true if you eat a lasagna with a lot of calories, your IGF-1 will go up too. The difference is it'll actually stay up. And that's why people that eat lasagna get fat. People that eat a meat-based meal, their IGF-1 will go up and then it'll come back down. And so we have to manipulate our nutrition and everything in order to get the goals that we want, and peptides are no exception. So we use these IGF-1 peptides to give you a big push of IGF-1. And some of the names of these things, like CJC is usually mixed with a peptide called ipamorelin. They all have these funny names. Sermorelin is another one in that category. Tesamorelin is another one. And then there's one that actually is oral. Most of these are injectables. There is an oral one called ibutamorin or MK677, which is a popular one in our bone health group. And so all of these peptides are pushing IGF-1 up, but for a pretty short window, and then driving it back down. And the thought behind that is that it'll help improve your anabolic window. It improves muscle mass for the bone health people, improving bone health secondarily. And it is really popular because we see results. People really feel better when they're on it. It's kind of like, it almost feels like being on testosterone, but you're getting that like in a short burst. And then people will generally sleep better. They'll work out better. They'll recover better.
Interesting. Okay. And then what about this new or I don't even know if it's new, but it's new to me. I've been actually researching it here a lot, which is BPC.
Yeah.
Tell me about that.
Yeah, so BPC stands for body protective compound, and you'll see it as BPC 157, and it's available both in oral and injectable forms. The oral form we use a lot for gut health. We use it for people that have what's called leaky gut, if you're familiar with that term, because it really helps to heal the lining of the gut. When used as an injection, BPC will help to heal injuries. It works through fibroblasts, and so when you do it locally, like I had a shoulder surgery 6 months ago now. And I used it post-op, around the areas where I felt comfortable. And as a surgeon, I felt comfortable doing that myself. I would caution anybody who is thinking about doing that to not do that. But I used it because of that clear injury. And I had I think a pretty remarkable recovery where I was able to get back very quickly, still listening to my surgeon and his recommendations, of course. But I've used it for, I had a chronic Achilles tendonitis that I personally used it for. And this was an interesting one, injecting it like at the insertion of the Achilles, but it had bothered me for months. Oh yeah, it hurt. It had bothered me for months, and it went away like in 3 days, and it hasn't come back. So I really feel like I've seen it personally. I've used it in a number of patients, and they swear by it. So I think there is really something to it. It's not a cure-all or a panacea, but for the right application, I've really seen it work well.
I just can't get that out of my head now. Like the Achilles tendon.
Injecting myself in the calcaneus was super fun.
Oh my gosh, I can only imagine. One other thing too is, as we wrap up this podcast, which by the way is super helpful, you've given us a ton of clarity and a lot of things that I didn't even think we would touch on. And I'm so glad we even touched on sleep and peptides. But I interviewed an individual here recently on basically eradicating porn out of your life.
Mm-hmm.
And one of the topics that we talked about was this porn-induced erectile dysfunction. And he brought something to my attention. And as soon as he brought it to my attention, he pointed at me and he laughed. He goes, "Now you can never unsee it." And what he brought to my attention was, on the podcast, he's like, "Hey, have you noticed all these erectile dysfunction commercials lately, like for Hims and all these other places, and that offer, like Viagra and Cialis and those types of things?" And I was like, "No, I haven't really noticed much of anything." He goes, "Next time you see a commercial," he goes, "I'm just going to say it. You'll probably be like, oh my gosh, you're right.
Mm-hmm.
It's guys who are in their 30s, right? That are having these issues." He goes, "When Viagra first hit the market years and years ago, do you remember the commercials and the men who were in those commercials?" I was like, "Oh my gosh, yeah, they were all older men."
Yeah.
He's like, not anymore." So we're seeing, I think, and you probably, obviously you see it more than probably anybody, is one thing that will impact a man's attention for sure to go get immediate attention is his sexual health. But tell me what you see in your practice and what men can do about improving that aspect.
Yeah, well, let me just lead by saying if there is an issue with the vasculature of the penis, there's an issue with the vasculature everywhere. Now, the porn-induced erectile dysfunction that your guest was talking about, it's a little bit of a different deal, and I haven't listened to that episode yet. I look forward to it. because there's such a psychological component to that, and I'm sure you guys really dug into it. So this isn't quite that, but for people where that isn't the issue, when the penis stops working well, that means that likely the small arteries and veins and other areas of the body are doing the same, particularly of the kidneys and the liver and the spleen and the adrenal glands, like all of the areas where like you need really good blood flow. And so it's really something to pay attention to. So if you have erectile dysfunction, you need to be checking your metabolic function. Do you have prediabetes? What's happening from a glucose perspective? And really sorting it out. So that's part of our workup for everybody. So that's kind of irrelevant. But we do see this conversation about erectile dysfunction pop up, no pun intended, because the
I see what you did there.
Yeah, sorry. But it happens because we're talking about optimal health, right? So like what are the things that would really take you to that next level? And a lot of times, guys will say like, well, intimacy has been a little bit off, like, oh, well, let's chat about it. And one of the things I love about what I do now is the fact that we have an hour to go back and forth with people, and I interact with them asynchronously, some people a lot. And so I hear these stories because we open up that door and they bring it up. So yeah, I agree. 30s, 40s and up, erectile dysfunction is rampant. And so there are a lot of things we can do though. I don't have a questionnaire about porn. Maybe I should. But for now, we assume that it's a vascular problem until proven otherwise. And so some of the things we can do, we can tie this back to the peptide conversation. But I think it's good once you have an understanding of the vascular issue to then let's fix that problem, because there are a few things that will help you to feel better about yourself than performing well in the bedroom, right? And so there are some peptides. So a couple that just come to mind off the top of my head. Kisspeptin is a popular one. Ganatouralin is another one. They both work through testosterone receptors. And I don't think we're going to have time to talk about testosterone today. So maybe it's a V2 if you want to do that. But both of those peptides will raise testosterone relatively predictably, similar to some of the other commercial products that are on the market. And that can really help. And I do find that low testosterone is very, very common in men of that age as well. So 30s, 40s, I see low testosterone, not across the board. Some men still have healthy testosterone levels, but I would say the vast majority do not. And so you can definitely help that way. And then another thing that's really come to my attention recently is using the drug tadalafil or Cialis. Most guys think of that as like I take it, it's 24 hours. I can take it on date night. I can take it in the morning and it's going to work well. And it does. But there is actually some evidence to support using Cialis as a dementia prevention tool. And so I'm always looking for a biohack that has really fun side effects. So if you take a low dose Cialis, and we can actually compound it at a really low dose, like 3 milligrams. If you take a 3 milligram Cialis every day, then it'll improve erectile function every day, and will help improve blood flow to all those organs. And so while that's sort of covering up the issue, we need to be working on the metabolic side as well, the nitric oxide side, and fixing the underlying problem. But this will actually help improve blood flow while you're fixing that. And the fun side effect is having better erectile function. So that's a side effect I'll take.
Wow. Yeah. Well, actually, what I'd like to do, I do want to talk a little bit about testosterone. There's a lot of questions, I think, in society, and a lot of information out there. But I think like normal testosterone used to be, and correct me if I'm wrong, is it 200 to, it was like 1298, I think, was years and years ago. But then they've recently lowered it to like, I can't remember. Is it like 200 to 900? What is it now?
It's under 1,000 now for sure. I think it's 988 or something. But yeah, so, and I've got plenty of time. I saved lots of time for you. So yeah, testosterone is such an interesting topic, and the more I learn about it, for both men and women, but I guess we should focus on men. But yeah, so as you said, the upper end of testosterone, quote unquote, normal or reference range has come down. The reason for that is that a lot of the reference ranges that we look at, particularly through companies like LabCorp and Quest, those reference ranges they have nothing to do with optimal function. They are statistical averages. right? So you're looking at basically a bell curve distribution of quote unquote normal. So what we're seeing is when the average in a population of testosterone level decreases, then the reference range is going to come down. So it's not that we do better with less testosterone. It's just that the average has come down. And what's really unfortunate about that, actually, a lot of things, but the bottom end is more relevant. So the bottom end used to be, I don't know how high it was. If you go back, when they first started making these things, if it was even above, 400 ever, maybe it was probably in the 300s, but now it's, in the upper 200s. So what's happening is you've got guys that'll go in and they're complaining of signs of low testosterone, which we should talk about. And their primary care doc will likely not test testosterone, but even if they did, they would get a total testosterone. They'll say, "Oh, well, it's 550. I mean, you're in the middle of the range. You're good." But if you don't get all of the numbers, you don't know the whole picture. So for me, I see 550, and they might be good, but you have to get a couple other labs. You have to get SHBG, which stands for sex hormone binding globulin, which is the protein that carries around most of the testosterone in your bloodstream. You need to get a free testosterone or some equivalent test to understand how much of the testosterone that's in your blood is actually free and available to attach onto a binding site in a cell. You could have a 550 and have a very low free testosterone and have rampant symptoms of low T. But you do not qualify as having quote unquote hypogonadism because your testicles are making enough testosterone. So you will not get treatment from a provider who is following the traditional medical model. But yeah, this is something that I see, for guys with total testosterones 4 or 5. I've even seen it in 600, and I can tell you my story too. But even in the 600s, free T in the single digits, which is almost always symptomatic.
And what are the symptoms? Like, what do guys, when they come in complaining of like, "Hey, I think my testosterone is low," what are they feeling? What are they saying?
Yeah, well, most guys will think of the sexual symptoms, right?
Sure.
They're like, well, libido and erectile function. And yes, that's true. However, it's not just that. So honestly, before that happens, usually the symptoms are just fatigue. And these are kind of vague. This is why it's hard, but they're fatigue, brain fog, poor sleep, inability to maintain muscle mass, gaining body fat. And then you get libido and erectile function. I also hear, and this is really hard to quantify, but people will talk about just like the feeling of vitality, the feeling of vigor, like these sort of like weird words. We all know what they mean. Like, what it means to lose your vitality, but like, I don't know how to put a number on that. And people don't come in complaining of that, but what they will come into, they will come in and they'll say, after they're on replacement, they'll come in and they'll say, "Hey, I feel this thing. I feel this better. I feel this better." Right. And so that vigor, vitality come back, and then they understand what they were missing, because it's usually been decades.
Wow. That's you've given us a lot to chew on, and I want to make sure that and you've given us a lot of clarity too, by the way. This has been, I learned a lot. I was actually taking notes as you were going through some things here. If guys want to reach out to you and they want to find out more about what you do, what is the best way for them to find you?
Yeah, so I would say we're actually updating all of our websites right now. So right now, I would say go to our main website, which is optimalhumanhealth.com. And that's going to have mostly stuff for our program. What we're launching right now is a website called drddouglucas.com. And Dr. Doug Lucas is going to house all of our programs. And the one specifically I wanted to mention is something that we're doing called the HealthSpan Nation. And the HealthSpan Nation is going to be an area for people to come in and join a community of people that are trying to optimize their health. There's going to be a low-cost monthly membership with a weekly Q&A, community group, discounts, an educational call. I'm super excited about it. We're putting a lot of resources into it, and we're recording this, like you said, in November, and we should be launched by the middle or end of this month. So it'll be up and available. But that Dr. Doug Lucas site will have access and information to that.
You said drddouglucas.com?
Yeah, it's not up yet if you go to it, but
that's all right.
Yeah.
Well, this is being released on December 17th, so they'll see it then.
We'll be up by then. Yeah.
Awesome. Well, Dr. Doug, thanks for coming on today, man. Thank you for sharing your wisdom. Thank you for giving us some clarity, and also hopefully guys in our audience, if they're curious to hear more, that they will connect with you. So I appreciate your time, man.
Yeah. Well, thank you. You've given me a lot, and you've really helped me out in my life. So I'm happy to serve in any way that I can.
Well, thank you, brother. I appreciate you. Gentlemen, you won't have to look far at all. Head on over to thedadedge.com/453 for this show. Again, thedadedge.com/453. 453. As you think about your new year and you think about 2024, maybe it's time to optimize your health. Maybe this is the year to do that, where we are knocking on the doorstep of one of the biggest months for transformations, right? But we can either stick to those transformations or we can let them go, which the most society lets them go. Let's not let them go this year. And if you need some help, I know Dr. Doug is he'll be in your corner. So again, Dr. Doug, thank you so much for coming on. This was awesome.
Yeah, man. Thanks, Kim.
You bet. Gentlemen, go out and live legendary. Take care.